Question. Aldosterone acts on what two locations in the nephron?
Mineralocorticoids, like aldosterone, exert three effects on the renal tubules by acting at the late distal tubule and the collecting duct.
Why do patients with primary or secondary hypoaldosteronism have hypertension?
Hypertension results from increased sodium and therefore water retention.
What enzyme is stimulated by ACTH at the adrenal cortex, and what reaction does this enzyme catalyze?
ACTH increases steroid hormone synthesis in all zones of the adrenal cortex by stimulating cholesterol desmolase, the enzyme which converts cholesterol to pregnenolone.
Okay, another good question. An HIV positive individual is found to have hyponatremia, hypoglycemia, and hypokalemia. Hyperkalemia in a routine lab analysis. What is the likely explanation for these lab values? The correct, the possible answers are HIV-related destruction of adrenal cortex, that's A, B, glomerulosclerosis, nephritic disease due to HIV progression, C, hypopituitary function resulting from HIV-related infarcts, and D, a lab error in analysis.
HIV is a known etiology for primary Addison's disease.
So the correct answer is A.
Nephritic disease may also result from HIV. However, it would not explain hyponatremia or hypoglycemia. Hypopituitary function may cause secondary hypoaldosteronism with the lab profile described in the question. However, HIV does not cause ischemic infarct.
What laboratory test is used to screen for Cushing syndrome?
The hallmark of Cushing syndrome is increased cortisol, as demonstrated by an increased 24-hour urinary free cortisol excretion level.
What abnormal lab test is definitive and diagnostic of primary adrenocortical insufficiency?
Cosintropine, which is synthetic ACTH, should result in a brisk increase in cortisol levels. An abnormal cosintropine stimulation test implies a subnormal response of plasma cortisol following cosintropine administration, and it is definitive and diagnostic of primary adrenocortical insufficiency.
Why is ketoconazole used to treat Cushing syndrome?
Ketoconazole is an antifungal which inhibits cholesterol desmolase, preventing steroid hormone, which is cortisol, synthesis. Furthermore, it inhibits P450 enzymes.
What is the treatment of choice for adrenocortical carcinomas?
The only treatment with potential curative outcomes for patients with adrenocortical carcinomas is total surgical resection of the adrenal glands.
How does the embryologic origin of the adrenal cortex versus medulla differ?
The adrenal cortex is derived from mesoderm, while the medulla is derived from neural crest cells.
At what level of the hypothalamic pituitary adrenal axis is the defect in secondary adrenal insufficiency and in tertiary adrenal insufficiency?
Secondary adrenal insufficiency is due to insufficient pituitary secretion of ACTH. Okay? Tertiary adrenal insufficiency is due to insufficient hypothalamic secretion of corticotropin releasing hormone.
In addition to Cushing disease and perineoplastic syndromes, what are two other endogenous, meaning non-iatrogenic, causes of Cushing syndrome?
Adrenal hyperplasia or adrenal neoplasias, like adenoma or carcinoma, are responsible for 15% of patients with endogenous Cushing syndrome.
I would just add that the uninvolved adrenal gland may exhibit atrophy if ACTH levels are decreased due to negative feedback of cortisol in the pituitary gland. How does ACTH affect the sensitivity of the adrenal cortex for ACTH binding?
The sensitivity of the adrenal cortex to ACTH is increased by ACTH itself through the upregulation of ACTH receptors. We'll finish in 15 minutes.
Okay, we'll do one more question. This will be the last question. A patient with Cushing syndrome presents with abdominal striae. What is the role of cortisol in this physical finding?
Cortisol decreases fibroblast activity, which plays a role in the development of stria characteristically found in Cushing syndrome.
Thank you very much for joining us. If you like this kind of video, please like us, subscribe, and give us comments.
Good comments.
And we will produce some more videos and continue with the adrenal diseases. Thank you.